Today we're going to go over the 4 must-do exercises for your posture and overall spinal health. The key part that we want to instill in you is that notion of your spinal health. Kind of like brushing your teeth or flossing every day for dental health, we need to do the same thing for our spine. I would argue that your spinal health is a little bit more important than dental health, because if you mess up on your teeth, you could get new teeth. If you mess up on your spine, you can't get a new spine. So this is going to be key for you to work on a daily basis to get stronger and more flexible.
And especially for our patients out there, you guys are embarking on a corrective care program. We expect our patients to have accountability and participate in their care. So these exercises are crucial for you to do on a daily basis to really maintain that spinal and postural health. Because let's face it, we spend more than enough time with bad habits, doing things like rounding our shoulders forward, letting our head go forward for computers and cell phone usage, sitting in chairs, lacking that core activity, and we end up with these postural patterns that need some help along the way.
So that's why these 4 exercises are going to complement and add to your adjustments that you're going to be receiving. So one is going to be for improving our posture, opening up the front part of your chest. One is going to be helping to reinstate the proper curve into your neck. The other 2 are going to be for your core, to stabilize, again, your core, to help with your overall spinal position.
So our first exercise is the wall angel. The wall angel is one of my favorite postural exercises because it is really good at helping to externally rotate the shoulders, strengthen the muscles in the back of the neck, and those mid-back muscles that become weak when we spend too much time in this forward flex posture. So let's get into it. So Dr. Dan's going to demonstrate for us, and you're going to notice his hips are touching the wall, his shoulders touch the wall, and his head is touching the wall. His feet are approximately 1 foot off the wall. So your feet do not have to be touching the wall for this exercise. Once he has those 3 points of contact, he's going to bring up his elbows to shoulder height. He now has a 4th point of contact. If he can do so, he's going to rotate his hands up until his fingers touch the wall. Now he has 5 points of contact. If he can maintain all 5 points of contact, he's going to slide his hands up the wall as high as he is comfortable doing so, maintaining that pressure, and then he'll slide them back down to where he started. And he's going to try and maintain that slow and controlled for 10 repetitions. He would relax and repeat that a second time or a third time to get 20 or 30 daily. The goal is not to be done fast. The longer he spends against the wall, the more stamina and strength we're going to build in those postural muscles. Now, a couple of things. If, number 1, you're really tight, you might not actually be able to get that 5th point of contact. So we recommend that people spend a couple of minutes just trying to build the mobility and the strength to get their hands back to the wall. Alternately, you might have shoulder pain, and that might be really hard on your shoulder in that position, in which case we tell people to straighten their arms. So basically, Dr. Dan just opened his elbow angle there until he can have his fingertips touch the wall, and then you do more of a true, more of like a snow angel that you would have done as a child, sliding your hands up and down the wall, still maintaining contact throughout the movement. The second exercise that we're going to go through is called the prolordotic neck exercise. What happens with these postural habits that we have, the head tends to look down again and go forward. And so the head goes forward, but we also lose that natural cervical curve, which is very important for the health of our spine. So this exercise is going to help us strengthen the muscles to retract the head and regain the curvature of the neck. Let's get into it. So Dr. Dan has a band, and this can be done with these specific bands for this exercise, but it can also be done with a TheraBand or any other type of exercise band that you have at home. So his hands are going to go onto the handles. He's going to push his arms forward, and now that is bringing pressure, pulling at the back of his neck. So he'll let his head drift slightly forward. The second movement is his chin is going to raise to the ceiling, and the third movement is he's going to actually retract his head down and back. That's the hard one. He's going to hold that for a count of 10. He would relax and repeat. So we'll pretend that's 10 seconds so we can repeat again. Okay? So now, let's repeat one more good one, then we'll show some of the common mistakes. So the hands go forward. That pressure pulls on the back of his neck. It pulls his head forward. He lifts his chin to the ceiling, and then he retracts his head down and back. Holds for 10 seconds. We'll pretend that's 10. And then relax and repeat. The 2 most common mistakes that we see with this exercise being done is when we tell people to let the band pull their head forward, they want to look at their cell phone, so they're looking down, right? We don't want your head down, we want your head forward. So show us forward instead, Dr. Dan. There you go. He pokes the chin forward. Now he lifts the chin up, and when we tell people to bring their head back, they actually want to bring their body back, right? They lean backwards from the low back instead of retracting the chin. So we tell people, brace that core, engage the core before retracting the chin, so the only thing moving is the head being pulled back, right? So you want to do 10 to 20 repetitions if possible. If it feels good, you almost cannot overdo this exercise. Do as many as your neck can tolerate. And if you have any questions, let us know on your next visit. All right, so here's one of those exercises that is crucial for your low back health, the core, and stability. It's called the bird dog. So it can be done on the ground. If you have a yoga mat or if you have a blanket, you can put something down so that it can pad the knees and the wrists a little bit. So Dr. Dan is what we call in what we call the tabletop position. So hands directly underneath the shoulders, knees directly under the hips. Now, what is very important with these exercises is creating stability. So he is going to actually engage his core. He's making his tummy hard here before he does the exercises. The purpose of this exercise is to learn to move our limbs while maintaining stability of the spine. So Dr. Dan's going to move one arm to test arm movement while keeping his core tight. If that's okay, he's going to then test the other arm. And then if that's okay, he's going to test his legs to see how it goes, right? He does one limb at a time. Now, if there's no pain and no problems and you can maintain your balance doing that, then the goal would be to move opposite arm and opposite leg at the same time. And you only hold it for 3 or 4 seconds. The goal is just to show stability. You would bring them down and then you would switch. And if we notice here, his arm and his leg are basically forming a straight line with the torso, right? So we're not lifting the leg too high. We're not letting the arm sag down. We're trying to maintain a straight line across the spine. Now, I also want you to imagine if we had a tray of drinks on his back, the goal would be that he could do this exercise without tilting that tray or losing the drinks. That's kind of like the imagery of stability that we are trying to create. So we usually have our patients do 20 of these, basically 10 per side, daily. All right, this exercise is called the side plank. The side plank is another one of our core stability exercises. And it is a great exercise because it is really good at targeting the lateral muscles of the spine that help to create stability. It's also a great exercise because when somebody has a disc herniation, back pain, or significant back problems, sometimes doing a plank from both elbows and really asking the core to stabilize all the way to the torso can be quite challenging. So by doing this, we're really taking 50% of the load off of the spine and allowing unilateral contraction of the muscles on one side of the spine. So Dr. Dan, again, we're going to do this on the ground, on a yoga mat or a blanket if you need to pad for the elbow and the hips. So the first variation, you notice his knees are bent. So we're going to have him bracing from the knees and the elbow, and if he could do that, he's going to lift his hips up in the air, the goal being trying to get the spine to be in a straight line from the head down to the center of the pelvis. If he can maintain that, he'll hold it there for 20 seconds. If 20 seconds is too much, start with 10 and try to build until you can get 20 to 30 seconds per side. If the knees are easy and you feel like you could handle the next challenge, you notice Dr. Dan straightened his legs. So now his bracing points are going to be the feet or the ankles and the elbow. With the same goal, we're trying to get that straight line as much as possible here, really from the center of the face all the way down to the feet. Same thing, we're trying to get 20 to 30 seconds per side. You would flip, perform it on the other side, and then repeat that twice. So you would end up doing 2 side planks per side. Remember, if you're having any challenges with these exercises, if you have any questions, on your next visit, make sure you check in with us and we can review any of the specific details. Don't get bogged down, don't get beat up if it's not perfect. You know, consistency is victory, and it doesn't mean that we have to do these every day. If you miss a day, just get back on the horse the next day and try to be as consistent as you can, because really, we're going through a marathon here. This is not a sprint, it's truly a long game.
And especially for us as seeing patients for the amount of time that we have, really for us, we could determine a patient's, level of success in their spinal correction based on just their consistency of their exercises. So if you want to make sure that you're good and better in 5 months, 10 months, 2 years, 5 years from now, just do a little bit every day. That's always going to be the best thing for you to do. So again, have a great rest of your day.